Welcome back to the Pediatric Dentistry channel Tiny Thick Talks. If you are new to this channel, subscribe the channel, and for details of this channel visit the bio section, or you can also check out my first video. Sorry if there is any mistakes in videos or shorts. This is the most useful video because if you follow my channel you know that till now there is a 7 long video explanation of radiography in pediatric dentistry, but this is the revision video. You can watch anytime anywhere and revise full radiography in pediatric dentistry in few minutes. So first watch all the videos on our channel and let's start. It's all start with the history when the X-ray was discovered in November 1895 by William Conrad Roentgen by exposing his wife Bertha's hand with 15-minute exposure time, and the other inventions like Dr. Otto Virchow in January 1896 first dental use of X-ray. Then Western Enterprise developed bisecting technique in 1904. William D. Kulig invented first X-ray tube in 1913. H.R. Repper introduced biting technique in 1925. F.G. Fitzgerald introducing paralleling technique in 1947, and Yerjo Valley Petaro invented panoramic radiography in 1949, and the other invention. Then coming to the characteristics of the ideal radiography include the density, latitude, contrast, speed, sharpness, resolution, and image quality. Then coming to the X-ray machines, which include the details of each part and how it works. So it has main three-part tube head, positioning arm, and control panel. In tube head, it includes X-ray tube, transformer, lead shielding, cooling oil, aluminum filter, collimator, and in control panel include the line switch, timer, KVP, MAS, exposure button. Then we covered pediatric use of X-ray. Then coming to the intraoral radiographic technique include the paralleling technique, bisecting angle technique, and the other supplementary techniques. So paralleling technique use the central ray which should be focused perpendicular to the long axis of the film, with the X-ray film being parallel to the long axis of the tooth. And bisecting angle, which use the principle of Szymanski rule of isometry, that the film is placed close to the teeth and central ray is directed at the right angle to the line, bisecting the angle formed by the plane of the film and the long axis of the tooth. Then the other supplementary techniques include three techniques. First is bite-wing radiography, used to record the coronal portion of both maxillary and mandibular teeth in one image. Then occlusal radiography, used to take jaw radiograph of maxilla and mandible, and bent film radiographic technique, which is exclusively used for the children. Then we covered radiographic localization procedure. There are three techniques. Clark's technique is to locate and determine the buccolingual relation of an impacted tooth or foreign body within the maxilla. Then Miller's technique is used same as a Clark's technique, but it is used for the mandible. Then cross-sectional radiography, so X-rays are taken at the right angle to each other. Then we covered radiographic protocols and radiographic survey. When a new patient is seen at the dental office and no previous radiographs are available, it may be necessary to obtain a baseline series of radiographs, which is included in the radiographic protocols. To accomplish the task of radiographic protocol, specific X-rays are needed to be done at each age, which is known as a radiographic survey. So it includes 4 film series at the 3 to 5 years, 8 film series at 6 to 7 years, 12 film series for 8 to 9 years, and 10 to 12 years, and 16 film series 10 to 12 years. Then we covered panoramic radiography, which is an external radiography in which the X-ray film and the source of X-rays move simultaneously in the opposite direction at the same speed, which include indications, advantages, disadvantages, and its uses. Then we covered specialized radiography, which includes the xeroradiography, which is the method of imaging use the xeroradiographic copying process to record the images produced by the diagnostic X-rays. And xylography is the radiographic examination of the salivary gland. So this xeroradiography by Chester Carlson method, which contains the xeroradiographic layers of xeroradiographic plate, how it works, its advantages and disadvantages. And we seen xylography, which include introduction of contrast media with the indications and contraindication. Then one of the most important question, which is the radiation protection, starting with the three basic principle, which is justification, limitations, and optimizations. Effective methods for minimizing the exposure to patients, operator protection guidelines. Then radiographic infection control includes suitable precautions for prevention and spread of any disease. Then behavioral consideration in pediatric radiography with special recommendations for children with the disabilities. Then digital imaging in pediatric dentistry in context of radiography, which include the history, then classification of digital imaging in direct and indirect digital imaging, then information about charge coupled device, photostimulable phosphor plate, advantages and disadvantages, and lastly different digital radiographic technique, which include RVG, Digora, MRI, nuclear imaging, computed tomography, spiral CT, and cone beam computed tomography. I already upload in detail explanation videos of everything. Check out all the videos on my channel and let me know if anything you guys want in radiography other than this. If you want this PDF or any other PDF, just like, subscribe, and comment your mail ID with the topic, and I'll send you the PDF. New videos on Thursday evening 6 p.m. and Sunday morning 11 a.m. Also, we try to put MCQs according to topics in our shorts with the answer and explanation if needed, which will help you in Viva or NEET exam. Like, share, and subscribe the channel. Thank you.